Hello, everyone. Today, we're excited to spotlight Dr. Tatyana Reznik, one of the co-authors of the book, How Healers Heal. Welcome, Dr. Tatyana. How are you?
Thank you so much for doing this. I'm so excited to be here today.
Please introduce yourself for our audience.
Yeah, I'm Tatyana Reznik, and I'm an internal medicine hospitalist in California. And I'm originally from Uzbekistan, where I was a practicing cardiologist. And I'm also lifestyle medicine board certified and internal medicine board certified, and one of co-authors of this great book, How Healers Heal. In addition to this, I'm a certified life coach and a host of Voices of Women Physicians podcast.
Tell us more about your podcast briefly.
Yeah. Oh, our podcast is a lot of fun. It is podcast which features women physicians who are experts, leaders, innovators in various areas in and outside of medicine. And on this podcast, they share their inspiring journeys and share practical tips and strategies from their areas of expertise. So the goal of this podcast is to give inspiration and also to give practical tips to other people who would like to make life easier and more joyful.
I'm so happy to meet you on the online circle and to know that you're doing this powerful work with your podcast. And now that you're sharing your story in our book, it is just amazing. Thank you. So let's switch gears to lifestyle medicine. How did you come about learning about lifestyle medicine and deciding to get certified?
Oh, thank you so much. Lifestyle medicine, it actually had been kind of part of my life for so long, but it was really refreshing to finally put a name on it, to give it actual name. Because I was really interested in applying to my own life and applying to lives of my family, friends, and patients what are currently principles of lifestyle medicine, which is plant-based nutrition and other principles such as improving sleep and mindfulness. But just recently, a couple of years ago, I became aware that there is a American College of Lifestyle Medicine, and that there is actual new specialty exactly about that. So I attended conference and really loved everything what I heard and became interested to pursue a certification in lifestyle medicine and to learn more because I especially wanted to know specific data behind evidence-based interventions, to have actual science, actual data. We know from practice, from our lives, that we know what works and what doesn't. But it was really refreshing to have specific information, specific numbers about evidence-based studies, research supporting all of this. So I'm very happy to be part of it.
I mean, you have such a powerful chapter about how lifestyle medicine affected your life. I don't want to give it away. I want readers to buy the book and read your chapter. But how have you incorporated lifestyle medicine into your practice with patients?
With my patients, I basically have it as a part of my routine conversations, especially if patient shows any interest in other approaches. As a hospitalist, I see very sick patients all the time, patients with very advanced diseases, with many chronic illnesses, with complications. And frequently patients ask, is there anything else I can do? Yeah, you gave me those medications, it's great, but is there anything else? Is there any diet I can, or anything? And at that moment, it's so important to give people additional information, additional options, and I share what I know about, especially obesity and obesity-related complications, diabetes, coronary heart disease, and similar illnesses. Impact of lifestyle medicine interventions on those illnesses is huge. And sometimes simple steps such as improving diet, adding exercise, adding mindfulness, decreasing stress level, improving sleep, even small, tiny steps in any of those areas can really be life-changing at the long run, because all of this cumulative effect, little step today, tomorrow, but 1 year later, it could be much different life for a person, especially when it comes to losing weight, normalizing blood sugars. It's huge.
I love that. So not only are you giving them treatment for what they need, you're giving them hope that they can get better with simple steps, but they all add up to a very cumulative big effect in the end, just like in your story, and then for all of your patients. That's wonderful. Why so why should someone buy this book and read it? I'll give you two parts to answer this question. One, for doctors and healthcare professionals, and why should a patient read this book?
I think main reason for both of those group is it's inspiration. It is something like when I know somebody else achieved certain result, I want to know what steps this person took to achieve those results. If it is the same goal I pursue myself. For example, somebody lost weight. What exactly did you do? What did you eat? How did you exercise? What helped? What didn't help? And there are many stories, not just about weight, just one of the examples, but there are so many stories of amazing transformations people experienced with their own health. So for both physicians and non-physicians, it is really inspiring to know what did they do? Can I do that? Maybe it will help me too. Plus, for physicians specifically, because lifestyle medicine is such a new field and not many people know about this and know how to learn more about this, how to apply it to their own lives. I think it's also really inspiring to have those examples, and if they're interested to look more into incorporating it into their own training and their own life, I think lifestyle medicine has such a huge potential, and eventually it probably would be part of our regular doctor's visits for everyone, hopefully in some point in the future. But at this point, I think it's very important to be able to learn and to know and to use those very simple interventions, which every patient can do, at least a little bit, which can have such a profound effect and wonderful results.
I agree. Those are such powerful words. So we have hope, we have inspiration. Humans as in general, we all have struggles, whether we look happy on the outside, but everyone has internal struggles. And we have just opened our hearts in this book for you to learn from us and be inspired. And I love your summary of that. Thank you so much. What one takeaway would you tell someone who wanted to change their lifestyle starting today?
My takeaway would be start with small steps. It's not important to do everything at once. Choose what brings you joy. Choose what is easy for you right now, but take the step. Even if it is tiny little step, changing one meal a week. Not every meal, not every day. One meal a week, for example, on Fridays. Or walking a little bit. Like my dog asking me to go to a walk with him and I'm tired. Maybe today I still should go for a walk with him, just for a little longer. Making this one tiny first step in an area which actually enjoyable. Start with easiest one, just do it.
That's been a theme from a lot of our authors, and I think that makes everything so much more accessible for people. Like, yes, I can change too. It's just one thing, like drink more water, and that will give your body hydration, help your satiety, all these one little steps. That's great. Is there anything else you would like to add, Dr. Tatyana? And please also mention where people can connect with you, and we will link your podcast, of course. But anything else you want to add?
Yeah, I would like to add that I recommend everyone to read this book, and I recommend to look into various lifestyle medicine interventions, especially plant-based diet. I am so passionate about this. It's just amazing how much you can achieve by simple changes in your diet. So I highly recommend to look into it. And for physicians, I recommend you to listen to my podcast, Voices of Women Physicians, and for non-physicians too. For any person who would like some inspiration and would like to know interesting and amazing tips and strategies women physicians share in so many areas, not only in medicine, but outside of medicine too. You will hear about everything. Listen to it, subscribe to it, and share with your friends. I have a Facebook group as well with the same name, Voices of Women Physicians, where you will have access to similar information. Please join us. And also for people who feel overwhelmed, who feel stuck in a situation where they would not want to be, who feel that they have some ideas they would like to bring into fruition, but not moving forward for whatever reasons, contact me for a first free session. I will help you brainstorm, and I will help you to connect with resources which would be helpful for you. And if you choose to work with me as a coach, I would be really happy to help you. And I have CME available, so you will have CME hours for this. And I have 100% money back guarantee. Please contact me, and I would help you.
Thank you so much, Tatyana. You have a heart of gold, and it just shines through talking to you throughout our session today. I know you're in your heart, you just want to help everyone with everything, and that is so, so wonderful. Thank you so much.
Thank you so much. I am so impressed by everything you do, and thank you for this amazing book and for everything what you're doing for everyone.